Hello and good afternoon. I see a number of folks coming online, so we'll give another 30 seconds and then we'll get started. Good afternoon and welcome to the National Academy of Medicine's Culture of Health Program's second webinar entitled Messaging to Advance Health Equity and Public Policy. We are delighted to have you join us. And before we begin the webinar, I'd like to share a few housekeeping items, so please note the following. Today's webinar will be recorded and available on the National Academy of Medicine Culture of Health webpage. The format of the webinar will be 2 speaker presentations, followed by reaction remarks from the community perspective. We'll then have a moderated conversation between all of our speakers and then open up the Q&A session of the webinar, which we invite you to participate in. To submit questions for the Q&A session, please use the Q&A box on your screen. You're welcome to submit questions throughout the webinar to be asked during the Q&A session. Due to time constraints, we may not get to all questions asked, but we'll keep a log of the questions. At this time, you'll notice a poll on your screen that we would appreciate receiving your responses to. Thank you again, and I'll get us started first with a brief overview of the Culture of Health program and then an introduction to today's webinar. It is my distinct pleasure to provide an overview of the Culture of Health program. My name is Ivory Clark. I am a co-director of the Culture of Health program here at the National Academy of Medicine. The Culture of Health program was established in June of 2015 with a grant from the Robert Wood Johnson Foundation. The foundation asked the NAM to develop the evidence base and answer critical questions about how to create and sustain a culture of health, as well as to assist in delineating causes of and solutions to health inequities in the United States, with the overall objective to identify strategies to create and sustain conditions that support equitable good health for all those living in America. The program is an extension of the Foundation's vision for a culture of health, which is to place well-being at the center of every aspect of our lives. There are 4 goals that we have outlined for the program and are aligned with the mission. The first goal is to lead by identifying a set of consensus study topics that build upon one another, leading to a solid knowledge base that can inform a set of actions and partnerships to advance health equity. The program will have 4 consensus studies come out under it. The second goal is to translate by bridging science to action for impact on health equity and optimal health for all. Our third goal is to engage, to strengthen capacity in communities to continue to advance progress in achieving access to optimal health for all, as well as inform legal, policy, and system reform. And our fourth goal is to sustain, to transform culture in the United States to sustain progress made and accelerate progress in areas that still show significant health disparities. We have a 19-member advisory committee that provides strategic guidance to ensure that the program meets its intended goals. Our members represent diverse areas of practice, including research, policy, and advocacy, and their expertise spans across health, education, economics, technology, environmental science, urban planning, finance, community organizing, as well as local and federal policy and military health, to name a few. The full roster, along with the bios for each of our advisors, is available on the Culture of Health website. I'd like to talk to you a little bit about what we mean when we say a culture of health, the social determinants of health, and health equity. We do share the Foundation's vision for a culture of health that everyone leads healthier lives now and for generations to come. The National Academy of Medicine's Culture of Health program is working to create a shared understanding that health is more than disease, treatment, and what occurs inside the clinical walls. A culture of health exists when people recognize that health is linked to access to care, as well as the environments in which we live, learn, work, play, worship, and age. In 2017, the program released the Communities in Action Pathways to Health Equity report. And in this report, 9 social determinants of health were identified. These include education, employment, housing, transportation, the social environment, the physical environment, public safety, income and wealth, and health systems and services. Personal responsibility is a factor in one's health, but we also must understand that the choices an individual makes are dependent on the opportunities that are available to them. In comes health equity. And health equity means that everyone has a fair shot at living the healthiest life possible, or everyone in every community has a fair and just opportunity for health and well-being. That leads us to our second webinar of the Culture of Health program. We've invited experts today to provide research-based tips and techniques for advancing health equity and public policy. We'll have a case study which will illustrate how value-based messaging has proven effective in creating common ground while unifying communities and decision makers to create needed change. A community representative from We Act for Environmental Justice in Harlem, New York will provide insights and reactions to the webinar presentations to elevate the community voice. The objectives for today's webinars are available on the screen, and I will also read them to you. The first objective is to highlight successful strategies for messaging and communicating health equity and public policy. The second objective is to provide an example of a successful communications campaign that effectively utilized evidence-based strategies to engage key stakeholders to advance health equity and public policy. And the third objective is to identify current research gaps around effective messaging and communication for health equity. I'd like to take this moment to thank you for providing your responses to the poll. You'll now see the results displayed on your screen. I now invite Dr. John Dreisner, a physician, leader, and executive with 30 years of practice in the public and private sectors, including federal, state, and leadership roles. He's also the former commissioner of the Tennessee Department of Health and a Culture of Health program advisor. Dr. Dreisner, I invite you to introduce our speakers and begin the presentation portion of our webinar.
Well, thank you very much, Ivory, and thank you for that excellent introduction. I just want to also thank not only Ivory Clark, but Charlie Alexander, the co-directors of the Cultural Health Program that's under the office of President Victor Zhao at the National Academy of Medicine. And also it's appropriate to thank your colleagues, Julie Tarrant, who helped on logistics for this webinar, and Mariana Zindel, who will, the National Academy of Medicine Research Associate, who will provide closing comments for us as you see in the agenda. So we have 3 distinguished panelists, and looking forward to hearing from each of them. First, we'll hear from Jennifer Messenger, and then Ben Shishmas, and reacting to that, Rubana Ahmed. Jennifer is the Executive Vice President at the Public Health Practice of the Metropolitan Group, a national social impact communication firm. She works with nonprofits, public agencies, and foundations across the country on a variety of public health issues. All of her work includes a strong focus on multicultural engagement and collaboration with many different communities to improve health equity and optimal health for all. We also have with us today Ben Shishmas. Ben is the Government Relations Director of the American Heart Association in Nevada. He has worked on public policy with a great deal of success there, including a statewide initiative to raise tobacco taxes and require CPR in schools before high school graduation. Prior to that, Ben worked with the Alliance for a Healthier Generation, facilitating the implementation of healthy schools programs across Nevada and New Mexico. And he also has a former life as a teacher of health and physical education. And then finally, our reactor will be Lubna Ahmed. Lubna is the Director of Environmental Health at REACT for Environmental Justice. She is an environmental health enthusiast with a strong dedication to environmental justice. She also served as an Environmental Education Peace Corps volunteer in Nicaragua, and we're looking forward to her reaction as a member of the community. So without further delay, let me turn it over to Jennifer. Just a note to all of our participants, and again, thank you for participating. We'll go through our two presenters and our reactor. We'll have some discussion among the panel, and then we will take questions from all of you. If you have questions as we go, please put them in the Q&A, and they'll be gathered and provided to me during the Q&A session of our webinar today. So again, thank you. And now, Jennifer, please take it away. Thank you.
Thanks, John, and hi, everyone. Thanks for joining us today. I am sharing some work that Metropolitan Group did with Voices for Healthy Kids, which is the state and local policy initiative of the American Heart Association. Voices for Healthy Kids works to create communities where all kids have access to healthy food and safe places to be active, right? Critical components of building a culture of health. The challenge that Voices for Healthy Kids came to us with was that they were seeing their local grantees and advocates and partners in communities passing really good policies to create healthier environments for kids. So things like healthy corner store initiatives, safe routes to schools, other programs like that. But the challenge was often that the language in those policies to guide implementation was very general. And so what would happen is the communities that traditionally have power and voice to draw down the benefits and the funding associated with those policies did that, and communities that historically hadn't had the power to grasp those benefits and hadn't had the investments over time were left behind. And so rather than closing a health equity gap, sometimes those policies were actually exacerbating it. So the goal of this work, the outcome that the Voices for Healthy Kids was looking for, was that public policies would create really clear and focused language specifying where implementation and funding should begin as the policy was enacted to meet the greatest need and to increase health equity, that language wouldn't be left to chance, or people wouldn't say, let's just pass the policy and then later on in rulemaking we'll deal with trying to get that language in. Because experience had shown that when that was attempted, policymakers would say, you should have built that into the policy instead of coming to us now. So again, building that language in up front to the policy was the goal of this work. So when Voices for Healthy Kids went to grantees and started talking about that, the nonprofits and other funded partners that they work with in communities and at the state level also said, well, that sounds great, but we need some help talking about this, about how do we make this case? Because often when we try to talk about health equity, it's not a door opener with some of the decision makers that we're working with. So what I'm going to take you through is research that we did to inform, well, how do we get to that message and how do we come to a message that works across the political spectrum to open this conversation about specific language and the message guide that we created. And then Ben will take us through a case study from his work that really shows how this works in action. Before I dive into the research, I just want to give acknowledgement to Leanna Winnett and Larry Wallach at Portland State University, who were our collaborators in doing this message research, and particularly in looking at the values that we build the message platform on. Next slide, please. Oh, one more, please. Thank you. So I just want to give you some context. When I'm talking about health equity, we're using the same definition that was shared with you at the beginning, conditions where everyone has what they need and the way that they need to reach their best possible health. And so you'll see on this slide, when Voices for Healthy Kids thinks about whether or not a policy meets health equity criteria, it's looking at whether the policy explicitly benefits a racial or ethnic population and or low-income communities, typically who are experiencing health disparities as part of that definition. It explicitly addresses determinants of inequity. It includes provisions for measuring that inequity and then for monitoring and accountability of how well that policy is doing in increasing health equity and reducing health disparities. And then it also involves communities in not only designing the policy intervention, but also in monitoring the policy implementation and how well it's working. So with that in mind, let me give you an example. So there are policies around complete streets, which is active transportation funding along with new transportation funding. So when you're building a new highway or road system, you have to build in resources for biking, walking, rolling, other modes of active transportation. So when those policies pass, a municipality or a state has to determine where to start making those improvements. And again, we want that to happen in the place where the need is greatest. So here's an example from Englewood, Colorado, where their Complete Streets policy gets really specific about where implementation will start. It actually says in the policy language that the policy will build a transportation system that ensures universal access to historically underserved or disadvantaged groups, including the elderly, children, the disabled, minorities, and low-income groups. So that kind of language that really guides implementation is the goal of this work. Next slide, please. One caveat that I want to give you in thinking about this research that we did and the guide that resulted is the focus of this work was really at a pretty specific point in the policy development process that you see highlighted in blue on this slide. So the idea is that we're coming into this at a point where the decision maker already has agreed to the policy concept. So they've said complete streets or safe routes to school is a good idea, and now let's develop that policy. And so now the focus here is how do we get them open to the need for specific health equity language and committed to that language. And this slide that I'm showing you here is just acknowledging that, of course, there's a ton of work that happens before this, including really making sure that advocates are building a diverse coalition that represents the communities that are being impacted by the law or lack of a law. And then also all of the follow-up that happens with community and with decision makers to make sure that that policy language is actually enacted and enforced. So this is a way bigger spectrum than what I'm talking about today. I'm going to focus in on how do we talk to decision makers about that policy language. I will say, though, that the testing that we did and the resulting message is very effective with policymakers. We also tested it with a national survey of likely voters. And this language and these ideas about focusing policy implementation work really well at the community level too. And one thing Ben will talk about is how these messages are working for him in talking with community members and other allies and advocates as well as policymakers. I just want to make sure to flag that because I know a good share of folks on this call are working with community members as well as with policymakers. Next slide, please. So in our research, as in with all of your work, I'm sure we started with shared values, knowing that when people make decisions, they first apply their values and then they filter facts and information through those values. So we have to make a really persuasive argument that's grounded in those closely held values. Otherwise, the facts are just rejected. Often message frames are based on a single value, and that's often really effective. Here, what was really interesting is the narrative that we built is based on a combination of two values and a specific approach and outcome. And so I'm going to show you that in a second, but one pause that I want to make is just to say that Voices for Healthy Kids is very strongly committed to making direct conversations about health equity and racism and historic oppression common. And to arm advocates with the language and the tools that they need to have those conversations with anybody that they're talking to, so that we're continuing to create safe spaces to talk about this and increase advocates' comfort level with being in those deep conversations. They also recognize that for some advocates, starting a conversation with equity language can raise some concerns about some decision makers about unfairness, deservingness, shifts in balance of power, other things that we see in the national dialogue as playing out with decision makers as well. And the research found that equity itself is not always a shared value, especially in the way that we may be defining it. So what we knew is that we had to find the best and most effective approach to enter the conversation so that policy advocates were able to keep decision makers at the table and lay the groundwork and then move into more overt equity language. And I'll come back to that concept throughout. It's just important to know that this doesn't intend to be a conversation that says, let's not talk overtly about equity. It's a conversation that says, how do we enter into that conversation in the most productive way so that we can open the door for a very direct and solid conversation about equity. So back to values for a sec. We started in the research with looking at values that have been shown to be dominant and enduring values in American culture. That help people think at a systems level. So that means that we're considering changes to policies and social systems and environments, and we want values that keep people focused at that level rather than reinforcing a pretty reflexive default that a lot of people have to individual responsibility and individual behavior. And then we're also looking for values that resonate with people across the political spectrum, political ideologies, political parties. And then finally, values that align with the concept and intention of equity, even if equity is not the value that we're building this on in the way that we might define it. So from those values, we created messages and tested those with decision makers from both sides of the aisle. We verified it, as I mentioned, in a national poll of likely voters. It was a really interesting polling process. We designed it in collaboration with pollsters who work on both conservative and more progressive side of key social issues. And our polling included an oversample, this was about a year ago, an oversample in counties that switched from Obama to Trump in the last presidential election, because we really wanted to understand how a shifting national dialogue or more amplified national dialogue was affecting people's perceptions of targeted policies. We then field tested the messages with advocates, actually working in session and working with policymakers. And then we retested the revised and final messages in one more round with decision makers. And the guide now at this point has been in use for a little bit more than a year and continuing to work. And I really have a lot of admiration for Voices for Healthy Kids and the way they've kept this at the forefront and kept revisiting this and fine-tuning the messages. So what you're getting is a pretty clear, tested process. Next slide, please. So here are the messages. The messages are built on two core values. One is human potential, meaning the value for human growth and success, and if hope is what is possible for our country, and the belief that everyone is able to reach their full potential. And the other value is community, so connections, interdependence of our society, and loyalty to the group or community. Next slide. We also identified an outcome that likely voters and decision makers most want in their policies, and that's effectiveness. So that's whether a policy does what it is intended to do with little waste. And then next slide. We also found broad support for a preferred approach to creating effective policy, and that's targeted universalism, which is a concept developed by John Powell. And we're not suggesting we use that language, it's pretty academic, but the idea of it is that we're aiming to help everyone, starting where the need is greatest and then expanding to help everyone else. And that concept did really well with both policymakers and likely voters. Next slide, please. So that combination of values and policy concepts is what leads us to a productive conversation. And if you go to the next slide, I'm going to walk you quickly through the messages, and I'll give you a link at the end of this presentation to the guide where you can see all of these and find lots of tools for applying them. If you click, please. So we want policies to be effective, meaning the policy has the intended impact and resources are not wasted. So there's that effectiveness piece that I talked about. Next, please. We want everyone to benefit from the changes policies create, but we need to start with the communities that have the greatest need, then expand. That's targeted universalism. Next, please. That means looking at the places where is the greatest gap in opportunities for people to be healthy and focusing changes first there so people can reach their full potential. We can determine where that is based on clear criteria, and any community could be eligible. So that's the human potential value. And you also heard me saying the word eligible, which was a really key concept in our testing with decision makers and likely voters. What that's saying is that likely need, greatest need, isn't limited to a certain group or type of community. Rather, any community could be eligible for a policy to start there, and that will be determined based on criteria that we set up together. So this makes decision makers comfortable that as conditions change, people in greatest need could benefit rather than having policies locked into a specific place. I'm happy to return to this concept in our discussion if folks need more information there. Next, please. We can help communities work together and be stronger by expanding opportunities to be healthy. When people make decisions about their health or the health of their children, the choices they make depend on the options they have available. So here you'll see the community value, also a nod to personal responsibility. We want to acknowledge that people reflexively go to that and then point them back to the fact that we have to change community conditions. Next, please. And a really important, for example, to add in these messaging is a locally relevant example for that policy or for that geographic area that describes the challenges, the policy solution, and evidence that focusing language in that way brings the intended result. And the guide has a couple of examples that worked with policymakers. And then one more, please. Finally, we're asking you to include specific language in this policy to define where it should be implemented or funded first to meet the greatest need, then expanded to other communities. And again, there's much more in the message guide about how to specify that language to include health equity in the policy. Last slide, please. So this is the URL at the top for where you can download the guide, which summarizes the research that I just briefly shared with you in more detail. It also lays out the messages and gives additional tips and insights on how to counter some of the common opposition points to this kind of messaging, and also shares words to use and words to avoid. I'm Jennifer, that's my contact information, and my colleague Allison at American Heart Association Voices for Healthy Kids is there too if you need to reach her directly. Thanks.
Hey, Jennifer, thank you. That was really excellent work by your team, and really appreciate. I'll remember values override facts. That's a very important thing to keep in mind, and targeted universalism, the criticality of local examples, and working to help everybody reach their full potential. So look forward to our discussion. And now it's my pleasure to turn it over to Ben Schmiss, the Government Relations Director for Nevada. Ben, take it away.
John, can you hear me well?
Yes, you're coming through loud and clear. Thanks, Ben.
Wonderful. Well, although Jennifer and I did not work super closely together on our presentations, I'm really excited to see the overlaps. John introduced us as experts in the field, and I appreciate the compliment, but I feel a little bit more like the man in the arena. If you guys are aware of that poem, Brene Brown has made it very popular. This is an area that, as we've been trained on it in our role as government relations director, I've been very interested in. I've become passionate about it. About a year and a half ago, I was exposed to the health equity messaging guide through Voices for Healthy Kids, and I started to use that in the work that we were doing locally in the city of Las Vegas and Clark County, Nevada. And I was blown away by the crafted messaging and how helpful it was. And I'm going to share a story of how that impacted this work and how we were able to translate this messaging guide and some of the tools it gave us into interactions with elected officials and with community members that led to significant changes in policy and also funding appropriations for walking and biking and some different things. Next slide, please. To begin, one of the things that I learned in this experience is not to take for granted and assume that members of the community and elected officials understand what health equity is. They need to have it defined, but they don't need a 5-page document on it always. You know, this infographic and many of the other ones out there do a pretty good job at helping understand that health equity means everybody has that fair and just opportunity to be healthier, and then asking the question, what do you think that would look like in your city? Next slide, please. We went and we met with both local coalitions and members of communities that were respected and began conversations. And before I had this language and this messaging, we had a number of good interactions and a number of interactions where people were really suspicious of why were we trying to do this, and were we just coming into the community to tell them how unhealthy they were. And one lady, it was a truly uncomfortable interaction, and the ones they talk about and you kind of see in the movies where she looked dead at me and said, what, are you guys just going to come in here and tell us that African Americans have high blood pressure and that we're unhealthy? And I was speechless at the time because I had been working for months trying to build relationships within the community and do things. And I knew that my intent was good, but I left that meeting realizing that we needed to do a better job at coming to the table with allies and partners, and we needed to be really clear on what we were doing. And the messaging guide isn't the end all be all, but what it did is it helped me understand the shared values I was bringing to the table, and helped me to connect with community members that agreed with those shared values and would come with us. And so a shared value that exists around community that Jennifer talked about earlier, everybody should have that opportunity to be healthier. And we wanted to learn more from the communities where they felt the needs were greatest, what resources were limited, and opportunities that if they had, could help them face these health disparities that existed. And we were coming to the table because we felt we could be a part of the catalyst for creating equity and wanted to work with them. And that when one person in our community was affected, everybody struggled. And that helped us to build relationships both in the community. Jennifer talked about in her presentation, kind of the coalition building up front. I left that meeting where we received the rebuke of sorts and went back and we started a coalition, and we made sure to be better at listening and bringing people to the table from the communities that were affected the most. Next slide, please. So Jennifer did such a good job talking about this, but I want to emphasize that community core message. So I underlined a snip from the message we used a lot. So often when you go into decision makers, they want to go to, the stuff you're talking about, that's personal responsibility. People need to make the healthy choice. And, you get talking to a lot of people that you're not building on common ground, you're arguing about what it should happen. And when it comes to public policy, a decision maker is elected and they have a certain amount of power that you need to acknowledge. And so when we spoke to those personal responsibility lawmakers that didn't fully understand the system level thinking, on page 7 of the guide, actually, I had read through this the day before a meeting. I was like, that's a really interesting thing to say. It says, help people think at a systems level means they are considering changes to policies, social systems, and environments rather than thinking only about individual behavior and responsibility. What I think is so fantastic about this guide is it provides custom messages like this, where you say, when we can help communities work together and be stronger by expanding opportunities to be healthier. When people make decisions about their health or the health of their children, the choices they make depend on the options they have available. That message I personally used almost word for word in multiple meetings, and it resonated so much because it is an understanding and acknowledgement that, of course, we need to make sure that people are making healthy choices and they have the right to make that choice, good or bad. But part of their role as a public elected official is to give them the option and the opportunity to make the healthy choice. And that message really resonated with both community members and our elected officials. And it allowed us to build common ground and to bring those community members and elected officials together that hadn't traditionally worked together. Next slide, please. So this story right here really ties together all the things that Jennifer mentioned and that the guide does. So the picture you're looking at here is a picture of Peggy and her granddaughter, Parker. And I was driving down the road in my truck with a videographer to go to the most dangerous intersection in the Las Vegas Valley. And I noticed out of the corner of my eye, this lady in the scooter was something strange. I couldn't see Parker at the time. And she was in the street, and on the sidewalk, she had been weaving, and she was worried her chair would fall off the sidewalk with Parker because the light poles and the telephone poles are right in the middle of the sidewalk. And it technically, she had enough room, but it was so close, she was afraid with her weight and some of the other factors that she shared with me after I stopped. And so she chose to go in the street, but she was afraid because there was the bus lane right there as well. And I turned the car around. I told her, I said, can I speak with you? We work on this thing called Complete Streets, and we try to make it safer for all users. And do you feel safe on these streets? And she said, no, it's not acceptable. We made a little YouTube video. We literally on the spot asked her if she would be on video. And we made a video with her. And she describes getting stuck in her chair the week before and having to call the fire department to get her out. And it was on a sidewalk, and she tried to weave around, and the tire fell into the light dirt there, and she was spinning, and she couldn't move it. She didn't tip over, but it was embarrassing for her. And then she described what she was doing the day that I took this picture, that she was just going to the grocery store and that she'd like to go to the park more with Parker. So at the time, I knew not a lot about all the market work and messaging that Jennifer and her team had done. But you look at human potential, and you look at that little beautiful granddaughter, Parker, that's 3 years old, and her grandma wanting to get her to the park so she can be active and interact with friends and live this healthy life. And the human potential there, and then community and the connections of this lady being able to to not only go to the park and interact with other people, but be able to get groceries to be able to provide for her and Parker and their family. And I didn't, have all that information at the time, but this story, one, we were able to go to that spot in the sidewalk where she fell off. She had to go around because they'd had some construction there and they didn't ever put the sidewalk correctly back in. So we contacted, as a coalition, we contacted the city public works people, who contacted the county public works people, and they went and redid the sidewalk. And I think that's a great example of how the small work that we do, the one little step that impacts the one individual, that was the tipping point for our coalition, where we had an impact and we started to get the community to buy in. Then we shared this little quick video we made, and we reached about 2,100 people. Then we made some other videos and some other things. We ended up getting about 50,000 hits on the 4 videos that we made out of this situation and a couple other ones. And that experience allowed us to go to elected officials, both of the Regional Transportation Commission and the City of Las Vegas and the County Public Works. And now they ask us to come out to their meetings to give them feedback and input on, updating their standards, adopting PROAG, and some of the different things that you do in the Complete Streets work. And so, next slide, please. Through the coalition work we've done and some of the other things, we wanted to keep that community messaging and not just have it be about Complete Streets, but really about creating a community that has fair opportunities for everybody to be healthier. So on the left, you'll see, and this was incredible, we did not pay for any of this, but we put together a community bike ride as a coalition, and we had to limit it because we wanted it to be authentic, and we did not want the police to come and block off the streets. And that person you see in the front right there in the white shirt, that's Councilman Lawrence Weekly, and he came out, and he's a county commissioner, and we had about 25 of us, and we stopped in and drove throughout the 89106, which is one of the most, if not the most, unhealthy communities within Las Vegas. It's also been part of redlining and some of the historic racism that has existed here. I'd never been in 89106 before I started this work, and our coalition and the American Heart Association has learned a lot by interacting and being part of that community and some of the decisions that are being made there. And the Review Journal came out and they put it on the front page, which is the largest newspaper in Nevada. And that really helped both our ability to be recognized, but then go to elected officials and say, we'd like to update these policies so that we can have language in here that reflects the idea. And we didn't use the term targeted universalism intentionally because the guide talks about not using wonky words. It has a left and a right side, which is fantastic, where it says, don't use this word, use this word. And so we talked to them about, we want to make sure policies are effective, and we need their help identifying the areas of greatest need and starting there, but expanding to everyone. And that concept of this isn't just about one demographic of people, it's about everyone, but we're going to start where the needs greatest. And we're not going to limit that to one group. Next slide, please. Through these efforts, we were able to engage the Regional Transportation Commission of Southern Nevada, City of Las Vegas, City of Henderson, and the county. And we were able to update the Complete Streets policy for the RTC to include health equity language. We also, early in this work, were able to help pass a fuel revenue indexing thing, which brought in $2 to $3 billion, which is unheard of in Nevada, for infrastructure projects and construction of roadways as we're expanding. And in that fuel revenue indexing, we've been able to advocate at the RTC and the city level appropriations for projects that consider all users for walking and biking appropriations. And we've had a lot of success with that. Next slide, please. So this isn't optional for us as the American Heart Association. It's our mission. We're making success in seeing policies. I think the state of Nevada is a good example of what Jennifer was talking about. You know, we have a history of not considering these things. People will acknowledge them, but they do not want it in policy. And we're taking some baby steps, and I would even say that we're a little past baby steps finally, that we're actually considering health equity in the policies that we look at, and our voice is the voice that's been invited to come. We, targeted universalism, a big word. We want to know what the communities that are facing the greatest needs are and how we can address those. And we truly feel that we can frame that in a way and then execute it in a way that allows us to do the work to benefit everyone. When we have a community where you can walk and bike safely, instead of having a nice bike path up in Summerlin or one of our affluent areas that goes and stops at the edge to connect it to the city, to connect it to Henderson, to connect it to our parks and trails out at Lake Mead, that makes it better for everyone and safer, and it allows all of us to connect throughout our community. Next slide, please. And that is the end for me. So I look forward to talking to you guys a little bit more at the end. Thank you.
Ben, thank you. That was terrific, and I appreciate your reference to the man in the arena, famous poem by Teddy Roosevelt. It is not the critic that counts, and thank you for the work that you're doing so obviously well there in Nevada. Now we're going to turn to our reaction from the community perspective, and to Lubna Ahmed. Lubna, we look forward to hearing some of your thoughts about what you heard from Ben and Jennifer.
Excellent. Thanks, John. Hello, everyone. My name is Lubna Ahmed. I am the Director of Environmental Health at We Act for Environmental Justice. And I just wanted to provide a little bit of background for those who don't know who We Act is. Next slide, please. So We Act is an organization who we've existed for over 31 years, and we work to build healthy communities by ensuring that people of color and or low-income individuals participate meaningfully in the sound and fair creation of environmental health protection policies and practices. We place a lot of emphasis on the meaningful participation piece, and We Act really acts as a facilitator and a mouthpiece for the community, and we're constantly playing the role of kind of the middleman between academic research institutions, elected officials, and kind of bridging the gap between those individuals and the larger community and local residents. Next slide, please. So in terms of how We Act works, we engage with research institutions and academic partners in that we take some of the research that's been done and we translate it into layman's terms. So sometimes that means translating research into Spanish for monolingual communities, and sometimes that means just translating it in a way that can be usable by community members. We then engage in a process of advocacy, so ensuring that our members really understand how to use the information gained to advocate for themselves. And then, as Ben mentioned, it is really important to begin the coalition building process at the onset. And so in terms of how we incorporate research and advocacy into organizing, that's our focus, is to really engage in this coalition building and ensure that our members are, again, participating meaningfully in the creation of environmental health protection policies and practices. And so I just wanted to touch on, first of all, thank you, Jennifer and Ben, for excellent presentations. Jennifer, I thought your messaging framework was very straightforward and very easy to understand. And Ben, thanks for sharing your stories with us. I think that's a major thing that is often a missing piece when it comes to messaging, is really hearing the community's voice. And I think you did a really great job in that. In terms of just other areas of messaging, for community members to really understand these complex messages that are being relayed to key stakeholders is extremely important. And I think just educating the community on how
No, we just lost you. Or I am lost.
I can hear you, John. I cannot hear it.
Okay. So we are still in the call, but Lubna, if you can hear us, you might be on mute. Who among us has not inadvertently hit their mute button or Lubna, are you there?
Yes, I'm here.
Okay, good. We've got you back and we can hear you. Please go ahead.
Okay, yes. So I'm not sure what the last thing is you all heard, but in terms of our community members understanding their options and what choices are available to them in terms of how that translates into messaging is very important. And so, you know, this kind of translates into what Ben was talking about with, you know, community members have the right to talk to elected officials and engage in lobbying efforts. They just may not know exactly how to do that. And so that may require some training on how to effectively do so. Also, to Jennifer's point, in terms of providing definitions, and Jennifer, you specifically talked about this in terms of health equity. And, you know, health equity, as you mentioned, is not always something that all people may be in alignment with. It may be something that people are more interested in from the equality standpoint, but really providing the explanation as to why equity is important and focusing on, you know, those who do have the greatest need. That is essentially
Lubna, we lost you after essentially. Sorry to our audience, we're having some technical difficulties. I'm going to give Lubna just a minute. I just want to remind everybody that you can be submitting questions right now. We'll launch into the panel discussion here in just a moment, but we appreciate that we are getting some questions from the folks that are on the webinar, and you're welcome to continue to submit them. They'll be curated, and we'll get to as many of them as we can. Lubna, have you rejoined us?
Hi, John. This is Ivory. I think Lubna has run into some technical difficulties, so I would suggest that we move into the Q&A portion, and we'll work to get Lubna back online, and she can provide her final remarks at the end.
Okay. Well, the best laid plans can sometimes be thwarted by technology, so we understand that, and thank you, everybody, for your patience. So we're going to get to questions, and we have Ben and Jennifer with us. And I think I'd like to start with a question for Jennifer. And Jennifer, you focused on conversations that people might have with decision makers. But you also have some information about how these messages tested with likely voters. What else can you tell us about that?
I'm happy to tell you more about that. I do feel a strong desire and obligation to take one step back, though, because there are a lot of questions coming in, and I can feel the energy coming from those questions, and so I don't want to go farther without addressing this. There are amazing questions being submitted here about what does this health equity messaging do to dismantle a racist and broken system? And what are we doing when we're talking about culture of health to overtly address white supremacy? And these are critical questions that I know we're all thinking about and working on. This particular research focused on how to be most effective in creating the most equitable policies we can within the current system. The focus of this research was not on how to talk about white supremacy and how to overtly dismantle a system. We know that the system is built on systemic racism and oppression, and I believe those are social determinants of health that we have to address. And so I just want to own up to the limitations of this research and these messaging, which intentionally are trying to navigate the limitations of the current system. If we can pass policies now that advance health equity, that prioritize communities that have been left out of health equity, that are continuing to be targeted by industry, by lack of investment, by disproportionate health outcomes, we will make an incremental change. It's not the ground-shaking change that I know we need to make. So I just want to be overt about the limitations of this and where this fits in within a vital and much needed bigger conversation about systemic inequity. So I want to own that first. To the specific question that you just asked me about whether and how these conversations also resonate with likely voters, yeah, let me tell you a little bit of that. So I mentioned to you that in addition to the work with decision makers, we did national polling to look at how likely voters understand these messages about some communities have access to healthy options and other communities don't, and how has that happened, and how might we create that, and what happens if we start with policy change and funding where the need is greatest and then expand from there. So in our polling, the majority of people in that poll agreed with some core health equity focused messages. So the majority of likely voters strongly agreed with the statement that no one's health should be compromised because of who they are, where they live, or how much they or their parents earned. Likely voters agreed that the goal of public policy should be to make everyone equitably eligible for new policies, focusing first in communities where the need is greatest. And like any other policy, people are most on board with that when we're talking about healthy options for children, right? We know that talking about kids first is the greatest entry point into policy passage. To make policies most effective, likely voters said funding should go first to communities that lack the basics that people need to be healthy, even if it means their own communities would get resources later. And likely voters said they wanted elected officials to support policies that aim to give all people the opportunity to be healthy. And 3/4 of people said that that was a top priority for them. So we were testing concepts of health equity and concepts of equity that could be built into policies to make sure that the conversations we were arming advocates with to go have with policymakers would resonate with what policymakers were hearing from their constituents.
Thanks, Jennifer. I appreciate you addressing the question and the frequency with which we're getting questions about those types of systemic issues. Let me now turn to Ben. And as you were remarking on that, I was kind of looking at the poll numbers, Jennifer, from the start of our conversation, where most of the folks on the call on this webinar are from urban and eastern environments. That was 41% urban and 39% eastern, and then aided by 13% suburban. And being a commissioner from Tennessee, and having spent a lot of my time in Central Appalachia, I noticed that 13% were southern and 13% were rural. The choices depend on the options available, and also the choices depend sometimes on the information available and known. And I know that Ben, you've been working in an area where mostly it seems to me to be kind of a micro-urban area. But I wonder if you encountered some of these kinds of issues in your community that Jennifer and some of our questioners have addressed in terms of systemic racism and its impact on our society and culture, and how your health equity messaging impacted the folks that you were speaking to who had those kinds of concerns, if that came up for you in any substantial way as you were in the arena.
Thanks for the question, John. So the zip code that I referenced back in the 1950s, in an effort to desegregate, they created a area called, I believe, the Prime 6 area, and they had these elementary schools and this little feeder school program that basically gave access to that the historic West Side, is what we call that area, to public schools and allowed for them to have, you know, quote unquote, an equal opportunity at the time. But it is those exact schools nowadays that have, you know, some of the greatest challenges and struggles in our school district. And so with some help from some researchers and some pretty good data, we were able to look at and really see the historic implications of that decision to carve out what at the time, and I think one of the questions that came through on this is, what are some of the unintended consequences? And so an unintended consequence of that decision then was those schools were carved out and given this certain designation, and that community in turn over the next 50 years had some of the most challenging educational outcomes in our state. So there's definitely unintended consequences of policies that at the time may seem like victories. But in the specifics of this presentation and messaging around health equity, one of the things that I found a lot of hope in, and I definitely focused on that, was, you know, that we have really clear message information within that policy that allowed me, as somebody that may not be the typical messenger, to go in both with decision makers and with members of the community and have a common message that people could agree upon. And if you're engaged in this work on the ground, finding common ground is not always something that's easy, because people have a lack of trust, both of their city government, both of groups like ours that are coming in trying to say, hey, we've got solutions to your problems. Well, nobody really likes to meet a new friend that says you got problems, right? I mean, it's not a great way of going in. And so instead of doing that, I really didn't feel completely ignorant to this type of work when I went into it, but I look back and realize the level of ignorance that I had in my beginning work here. The stuff that Jennifer presented on early and within the guide, you know, these common shared values are really, really important to, one, find where you and your organization are at, then to go out into the community and see, you know, do we have agreement on these things, and what does that actually look like to you in your space? So for me, I'm talking about the 89106 and complete streets, but I hope that my presentation today doesn't seem like it's limited to complete streets, because that's a small piece of the health disparities that exist both in the 89106 and throughout the Las Vegas Valley and throughout Nevada. Those shared values are universal. Both the parents in our high income areas, they want their kids to be successful and their potential to be great in America just as much as the parents in the 89106. And when you build upon human potential and community and how we can work together and take these barriers as the impediments to action and advance action through working together, you can really change the narrative and bring people together in a way that feels right and gets results.
Thanks, Ben. Really an articulate answer. I appreciate that. I also understand that we have Lubna back on. Lubna, I wanted to give you an opportunity to kind of finish your thoughts and go to your last couple of points before we ask you a question. So I hope you can hear me, and welcome back to the webinar.
Yes, thank you, John, and apologies for that. I just wanted to, next slide, if we could just touch on these last couple of slides. And I hear the conversation kind of transitioning in that way, and just wanted to talk about, from the community perspective, what really effective engagement requires. And in terms of genuine personal connection, this is something that the community, I feel like, is very intuitive with, in terms of the community understanding, if you're somebody who actually cares and are listening and are repeating back the messages that they are providing to you. Also operating with respect Are you giving the community the microphone? Are you respecting their point of view and perspectives? Is this being made clear? Providing really conscious explanations to community members in terms of language and education level. Again, as I mentioned, sometimes that means really focusing on language justice. So providing translation of all the messaging that you are providing, and then making sure that it is in language that is really comprehensible, and that it's not using words that are way too big, and really sticking to an education level that maybe is from a 6th to 8th grade reading level. And then also ensuring that there is relatability in the work that you are doing, really applying this to the local population and tying this to their lived experience. Next slide. And then just some other important considerations for community engagement. As I mentioned, language is very important. As a community-based organization, we focus heavily on language justice. Also considering location and time when you are meeting with community members. Are you meeting community where they are, or are you having meetings in a place that is really difficult for people to access? Time is also very important, not only in terms of length, but in terms of what time of day you are engaging with community after hours when people are no longer working, potentially on weekends. Those are times that typically work. And then ensuring that an overall climate of empathy is being exercised. So not just something where, information is being collected and recorded, but that, people's voices are truly being heard, whether that be in the form of storytelling and not just data gathering. I touched on the point of respect, and then also this point of trust. I think this is also something that the community is very intuitive about. And when we talk about trust, we mean also acknowledging, the past. Things like, for example, Tuskegee is something that study ended in 1972, and there's a lot of academic institutions and elected officials that talk with community members and don't acknowledge some really painful past histories that community has experienced. So really acknowledging that stuff and being very genuine and building this relationship of trust is very key to engaging with community members. So apologies for that presentation being a bit scattered, and I just wanted to ensure that I was able to fit in those last few points. Thank you.
Well, thank you, Libna, and really good recovery from the technical difficulties that we had. So we'll kind of go back to our discussion. A lot of questions coming in. I think your quotable quote, Libna, there is giving the community the mic. And so I want to ask you that I know that REACT's your mission is community driven. And maybe you could talk about some strategies that you use to assure that REACT understands the community that you're in, how others can do that, and by the same token, how the community understands the proposed laws and policies that may be impacting them, so they can get their voice to the table effectively and hold that mic effectively.
Yeah, definitely. So, as I mentioned, REACT is an organization that has been around in the community since '88, and we engage community really through our membership base. So we have a membership of over 800 local residents who we meet with on a monthly basis at a membership meeting. And we go over a variety of topics that we feel not only will be informative for community, but very important for community to weigh in on. So one month we may be holding a membership meeting that really discusses city and state policies. The next month we might be talking about certain products that have become really popularized in the community, beauty products, for example, that are particularly marketed towards women of color and children, and really talking about, what are the health effects of those products. So we try to focus on things that are relevant to the community. We engage them through this kind of educational process, but then also we do a lot of kind of workshopping in that we help community understand existing policies that are in place and how they can be equipped to influence those policies. So, going through what policies exist that are related to issues faced by the community, and then really explaining what does, how should you interact with the elected officials if you want to amend a certain policy? What do lobbying efforts look like? How can you, for example, go to the State House and have face-to-face contact with an elected official, which these are all things that community has the right to do and can do. Sometimes it's just a matter of them being equipped with the right tools.
Great, thank you. I want to mention to folks, because we're getting so many questions, some of our panelists would like to tell you that they're going to get to whatever individual answers they can, but there's certainly too many for any one person to be able to answer in the context of our conversation here. But let me send a question here to Jennifer. This question came from one of our members. Is American culture white American culture? How is American culture defined, and what does that look like? How does that address the intentional inequity that's been the structure of American culture?
Yeah, it's such a good question. Yeah, I'm happy to respond. And I have to tell you, I cringed when the words American culture came out of my mouth, and I almost corrected it, so I was glad someone asked me about this. In the research, and several other people in the questions have asked how we got to the values that resonate broadly. So we looked at a variety of research, including the Moral Foundations work of Jonathan Haidt. We looked at frameworks research, we looked at research coming out of PolicyLink, we looked at a lot of other research around sort of commonly held values at the macro cultural level. And I say that recognizing that American culture is not a thing, and there are a whole bunch of different cultures and different values depending on who the community is, who we're talking about, where the decision makers are, where the power lies. But what we were looking for was values that resonate broadly across decision makers and across likely voters at an aggregate level. And so that's where we came to human potential and community as being among a set of values that we could start to look at if we segmented out values that point to personal responsibility, right? So values around like pulling people up by their bootstraps and individual freedom and determination and things like that. Those are not helpful values if we're trying to stay at a community change level and get people in an equity mindset. And so as we culled through those values and found a set of values to test, human potential and community fit that criteria. And then also in our testing were the values that the broadest number of people across the spectrum resonated with, that then also proved to be effective at keeping the conversation at a community change level and opening that pathway to policy language that focuses the policy where the need is greatest at a starting point.
Well, let me segue to a follow-up for you on that, because we've gotten a number of questions on the phrase targeted universalism, and that's more, I guess, an academic phrase. And as you just said, starting where the need is greatest to then expand. That's the concept. But how might you articulate that particular concept to a general audience? And then what would you say is the best way to show where the greatest need is, particularly if it's a decision maker that may have somewhat different values than the speaker?
Mm-hmm. So the way that we found to make the concept of targeted universalism relevant is exactly what you just said. To make a policy eligible, we know it can't really start with the aim of helping everyone, because then it helps no one. Like most policymakers and people likely voters understand that. And so then to be most effective in the policy, we want to start implementing that policy where the need is greatest and expand. And in the messaging and in the conversations we had, this is where that concept of eligibility landed, right? So where is the need greatest? Well, let's determine together as we craft this policy how we will define that. Are we defining that based on income? Are we defining that based on health outcomes? In the case of a complete streets policy, are we defining that based on who doesn't currently have access to safe and active places to walk and roll and bike? Are we defining that based on the level of investment in a community previously? There are a lot of different ways that a community can define that, and the idea is that by defining that together, you're setting the standard for, or you're setting the guideline for establishing where the need is greatest. We did in our testing test with both policymakers and voters the idea that we should start first where there has been systemic inequity, or where there has been historic racism and oppression, or where there has been lack of investment. And the challenge that policymakers came to, and again, I'm acknowledging I'm working in a white supremacist system, and we're trying to do the best movement we can within that construct. The challenge was that policymakers were nervous about locking into a policy to benefit a specific population at the exclusion of others. I understand that that needs to happen, but that was a sticking point for policymakers. Among likely voters, even voters from communities that tend to be affected or disproportionately invested in or experiencing higher rates of disproportionate health outcome, that concept was also rejected. What people wanted was, they weren't rejecting the idea of directing resources to specific communities if that's where the need was greatest. They were responding to the exclusion of others. And so what they wanted was, let's set the standard for where people need the most help and then start the policy there. And we might decide that that's this community and that community that look really different and have different historical conditions, but are both experiencing the same negative health outcomes now.
Very good, thank you. So let me kind of turn a question to the whole panel, and we're getting several questions about lack of resources and how lack of resources and those types of allocations decisions that have to get made impact on our approaches to this, trying to move a culture of health across the United States. I would say one thing, I think importantly, parenthetically, we're clearly focused on the United States in our conversation here, but I think there's some general appreciation that we are our brother's keepers, and in a country that spends more on healthcare than every other country in the world, and it has a GDP devoted to that that's greater than the entire budgets of all countries in the world except 4. I'm always mindful of the fact that we expend much more than our share of resources globally, and there are always limitations in resources. But thinking about where the need is greatest and directing resources in those areas, how have any of you thought about talking to your decision makers at the community level, at the state and federal levels, about how best to deploy those precious resources?
This is Libna from WeAct. I can just kind of take a shot at that first. In terms of engaging with city and state officials, in terms of really emphasizing health equity, we do, emphasize that environmental justice communities, such as the community of Harlem, is disproportionately impacted by, certain health conditions, such as poor housing quality. The largest concentration of public housing in the nation is located right here in East Harlem. And, the health conditions such as the exacerbation of asthma that comes from those poor living conditions then really contributes to people visiting the emergency room, having to pay medical bills that they're not able to afford, and really is actually an inefficient process in terms of the health system. And so really applying it to kind of the broader, the bigger picture when we're talking to elected officials like that. And you know, unfortunately, not everyone is always concerned about like EJ communities or minority communities. And so really taking that and magnifying it to larger systems, like if we were able to fix housing conditions in uptown in northern Manhattan, and the amount of money that would save for the overall healthcare system, what that would do. So really putting it into these larger perspectives, and then also emphasizing that, you know, focusing on health equity and really tending to the needs of people who have greater needs is actually going to help the overall. It's going to help the public's health. And so, you know, really speaking to those points is what we as a community-based organization emphasize.
Thanks, Vivek. Ben, have you been able to think about that at all? When the increase on tobacco taxes occurred in Nevada, for example, and you know, I've always advocated for the increase in and of itself, regardless of where the money goes, because that in and of itself is an evidence-based population health benefit. But was there any opportunity to create additional resources to work on some of these health issues in your communities, and how were those decisions made in Nevada?
That's a great question. So we're actually in the midst, in about the next 24 hours, of having, you know, e-cigarettes become also included that, and we did get an appropriation for that. So excited about that work. As you asked that question, you know, we passed that $1 increase to the cigarette taxes in 2015, and I think it's a good example of what we were talking about earlier. And by a good example, I mean a bad example of, you know, you're doing a tax on a product that is used in higher percentages amongst vulnerable populations, and none of that funding went to tobacco prevention and control in 2015. And so what happens there is the benefit to the public health is simply, and it is effective, we raise the price drastically so it reduces consumption. So it has the health benefit in the public health sense of reducing consumption, but none of those funds were explicitly earmarked to tobacco prevention and control. We've learned from some of those lessons, and we've been able to take a step forward in being able to advocate and get funds allocated to tobacco prevention and control. But I think what we're speaking to on this call is ensuring that we have enough depth in the language of appropriations and, you know, policies that we pass, that it actually, the benefit goes to those that have the greatest need. And in a state like ours, without getting into the political makeup, we're moving that direction. We're starting to see this in more of our policies, and the conversation is being received better both publicly and behind the curtain, but we're not there yet. And so our taxes for tobacco here do not have targeted universalism language in them, but we are working with our lawmakers. We have session every 2 years here. So in the interim, we do presentations and we work with them, obviously face to face, and are building in, and these are the same people. Getting back to the coalition building, although our coalition was focused on complete streets, by engaging in the communities and being part of the community and sharing these core values, we're building trust and relationship with, which allows us to then work with their elected officials in a way we haven't before. And that benefit to everyone concept works better in certain communities. And then it also has that benefit to bringing in lawmakers that we've never historically had the trust and relationship with. I don't know if that answers the question, but
I think that's a good answer. I'll add a piece to that. It's something that we did in Tennessee with some funding, not from tobacco, but from a health fund for health access. We created access to health and healthy built environment grants there were small, relatively small grants, about $10,000 that went to all counties in Tennessee. There was also a competitive grant program. And the way we engaged the community in that was we asked them what was important to them. And using a local process driven by local health departments, gave the community the mic, as Movement said, and they use those funds to do planning, to purchase equipment, to do matching, a whole host of things. But the bottom line is those things were important to communities. We're getting some questions about the panel's familiarity with engaging Native American populations. Lubna mentioned the Tuskegee experiment, and we got a question about how do you acknowledge the past in that context. I do want to relate to folks' recent travel to Australia, where acknowledging the indigenous peoples there has become a part of that culture. And I just found it interesting that at the start of most events, somebody would say, and we want to acknowledge the traditional owners of the land that we are now having this event on, and so forth. So I've also heard some similar things in the Northwest, although not precisely in that fashion. So I thought that was a very nice way to acknowledge the historic inequities there, and I'm wondering what Lubna, you've done in that situation. And also, if you could please mention your environmental health and justice leadership training program.
Yeah. So in terms of kind of acknowledging these ugly pasts that exist in our history, I mean, I think acknowledging it is exactly that. It's that you are really putting, you're looking at the problem in the face, and obviously doing that in a very conscious way. You don't want to rip off the Band-Aid and expose these really painful wounds, but really talking about the structural racism that has existed, and by putting that out on the table, you're showing people that yes, I'm acknowledging that this has happened, and putting it out there instead of kind of pretending that it didn't happen. And this kind of goes into the piece about transparency. It's that communities should be involved in every step throughout the process, and that begins with kind of acknowledging whether it be the elephant in the room or this big topic that may be not discussed. The other thing that's really important in this realm is consistency. So it's important that the folks who are working with community members typically stick around for many years and develop trust with community members, because and Ben, you kind of touched on this a little bit in that, the woman that you were talking to was saying, are you just going to come in here and tell me a bunch of negative stats about the African-American population and how we're more sick than the rest of the population? I think it's also very important for those who are engaging with the community, whether through the process or whether they are the messenger at the end, that they should look and sound like the community that they're engaging with. And even if they don't, I think it's important that those folks have built trust in the community, meaning that they've been around for 1, 2, 3, 4, 5 years, and are there because it is very obvious that they care and they've stuck around to do the work. Also, John, you mentioned the Environmental Health and Justice Leadership Training. This is a program that's offered through WEACT, and this training program is something that we do twice a year. We do it once with youth and once with adults. And it's essentially, as it sounds, it's a training that's on environmental health and justice, and it goes through a variety of different modules. So we talk about climate justice, food justice, we talk about open and green spaces and access to them. We talk about exposure to toxic products and household products, the importance of a healthy indoor environment, and really tying all those themes back into environmental justice and acknowledging the health equity lens. And we do that through a really interactive process. So not only are we delivering the information, but we ensure applied learning by setting up a program where the trainees can develop a project that centers around one of those specific topics. So for example, if a participant that's going through the program has a particular interest in food justice, they would investigate that topic in their community. In Central Harlem, for example, look at locations in the community where food is available, what options are around to provide solutions to this systemic problem of food insecurity, and really discuss this topic really in depth. And we often invite elected officials and just key leaders in the community to attend these projects that come out of the training program.
Very interesting.
John, I can say just a word too about, John, I can weigh in just quickly on working with Native American tribes too.
Okay.
We're doing some work in Oregon with Oregon Health Authority's tobacco prevention program, working with the 9 federally recognized tribes in Oregon, as well as nonprofits serving urban Indians and other Native American populations. And one of the biggest things I'll say, and those who work in Indian country know this, is that each tribe is very specific and unique. And so we're working really carefully with each tribe to identify the cultural strengths and elements that they want to pull into tobacco prevention programs and talking about health equity. And so we're supporting the tribes to tell that story about tobacco industry targeting and the theft of traditional tobacco by commercial tobacco industries, and really coming at health equity through that story and those cultural traditions. And so, I mean, it's been said 100 times on this call, like listening to the community and supporting the community to tell that story in the way that needs to be told is absolutely the direction there. There's also some research that First Nations Development Institute did a while ago, and looked at research about narratives about Native American peoples that are held by non-Native communities and how to shift that narrative to one of empowerment and strength and equity. And if you go to Reclaiming Native Truth, you can find that message guide, and it's got some helpful information on messaging and specifically talking about health equity and historic inequities and discrimination and genocide and colonialism within Native communities.
That is an excellent way to end our panel discussion. I want to thank our distinguished panelists, Jennifer and Ben and Lubna, and I also want to thank our National Academy of Medicine colleagues and Robert Wood Johnson Foundation for making this webinar and this entire effort possible. And I want to turn it over to Mariana Zindel for her closing comments. And again, Mariana is the Research Associate with the National Academy of Medicine. Mariana, the floor is yours.
Thank you so much, and thank you again to all of our speakers, our moderator, and all of our public participants for joining us today. Before closing, I would like to remind you that all of the materials from the webinar will be made available on the Culture of Health program website, including the recording of today's webinar, the presenter slides, and also any additional resources provided by our speakers. We would also like to share some upcoming activities for the program. The second consensus study under the Culture of Health program, entitled The Promise of Adolescence, Realizing Opportunity for All Youth, was released on May 16th. An in-person release event will be held on August 1st, 2019 at the Keck Center in Washington, D.C. You can register for this event at the nam.edu/adolescence opportunity website or on the NAM events page. The remaining 2 reports under the Culture of Health program will release later this summer and fall. The next stakeholder meeting for the Culture of Health program will be held on October 28th, 2019 in Washington, D.C. The registration will open at the end of the summer and will be available on our Culture of Health program webpage as well. The next webinar is under development and will take place in either late 2019 or early 2020. And to stay informed about all of the activities of the program, please sign up for the NAM Culture of Health program listserv available at nam.edu/cultureofhealth. Thank you again for joining us. The webinar has now come to a close, so we hope you have a wonderful rest of your week. Thanks again.